Start with the introduction. My name is Dr. Monica Gaur. I'm practicing in Dr. Lal Path Lab, Indrapuram. Practicing ultrasound since last 12 years, and I'm in teaching in somewhere around from last 8 years. So let's talk about the visibility, ultrasound visibility. Very, very important to know. Otherwise, it will be difficult for us to label it as missed abortion or blighted ovum or so on, or any other kind of failure of the pregnancy. So gestational sac, if we are doing transabdominal scan, it should be visible by 5 weeks plus minus 1 week, of course, because every woman has its own length of cycle. A big gestational sac with a fetal pole within. CRL is 1.94, 8 weeks, 3 days of pregnancy without cardiac activity. Another pointer in this case was the calcified yolk sac. Yolk sac was there, but it was calcified. So calcified yolk sac also goes in the favor of missed abortion. Cases of RPOC, they are heterogeneous in texture, not hypoechoic, not hyperechoic, or not hypoechoic. Heterogeneous in texture with multiple cystic areas. These are nothing but the blood contents at different phase, and we measure the whole thickness of the cavity and we write it in our report. 3 or more consecutive spontaneous abortions are called as recurrent abortion. They can be divided into 2 groups, first trimester and second trimester. Now, what can lead to the recurrent abortion in first trimester is very, very, very common is uterine abnormalities, specifically fibroids which are there in the uterus, and the one which are submucosal in ectopic pregnancy. Ectopic pregnancy is implantation of the fertilized ovum outside the endometrium, not only outside the uterus. We are talking about outside the endometrium. It may go and implant into the myometrium. So just forget about the word that ectopic pregnancy is something which is outside the uterus. No, it is not outside the uterus. It is outside the endometrium. We see that the cavity is empty. There is a lot of free fluid in the pelvic cavity. And as soon as we put the probe in the left adnexa, or we move the probe to the left adnexa, we see a good gestational sac with a yolk sac within. I measured the CRL also. It was 0.41 centimeters, 6 weeks and 2 days of pregnancy. Fetal heart rate was. It is said that when you see a good amount or good degree of fluid in the pelvic cavity or some in the abdominal cavity, you think on the line of rupture or so. But let me be very clear with you that not every time we are able to write acute ruptured, chronic, unruptured or whatsoever. So whatever we see, we write it as such. Extrauterine pregnancy, then the pregnancy is altogether not in the uterus. So it can be tubal in the fallopian tubes, it can be ovarian in the ovaries, or abdominal. Another thing is intrauterine. So intrauterine, first is interstitial. So interstitial is, again, it is nothing but the fallopian tube, but the part of the tube which is inside the myometrium, which is inside the uterus. So as soon as the junction where the fallopian tube starts coming out, that is the part which is called as interstitia, and the pregnancy implanted over there is interstitial pregnancy. See thick endometrium in the uterine cavity, whereas we see a sac-like area with the fetal pole inside. This was the blood flow due to the trophoblastic reaction, which is normal, of course, and the sac was located in the cervix. This was internal os, this is external os, and the os is closed. Of course, this will not grow in size in gestation, of course. So this is how cervical ectopic looks like. It's not every time that we see a lady with pain and bleeding and it is going to be an ectopic pregnancy. The other entity which can confuse us is ruptured CL cyst. Pain not be associated with overdue of period, CL cyst within the ovary. These are the points which can differentiate it. Patient 30 years of age, coming for the dating scan at 8 weeks, 1 day, and we see such a big gestational sac, which is measuring 21.3 millimeter in diameter, corresponding to 7 weeks, 0 days. No yolk sac seen, no fetal pole seen. A clear-cut case of blighted ovum. We see the uterus and the cavity appears to be empty. We go left and we see the ovary here.